Hello, everyone. I am Abigail Krutz, and thank you for listening today. I'm so glad that you're here. Today, we're going to be diving into something that's been gaining quite a bit of traction in the world of mental health, but it might still sound a little mysterious to some of you. It's called eye movement desensitization and reprocessing, or EMDR for short. Now, if you've ever struggled with trauma, anxiety, depression, or even just a rough patch at work, a rough patch in your life, this might offer you a completely new way of thinking about healing. EMDR is a psychotherapy technique that is not only innovative, but it's also fascinating. It works differently than traditional talk therapies, and get this, it doesn't even always require you to verbalize your painful memories. Sounds wild, right? So today we're going to be exploring a little bit about how EMDR works, what the science says, what the limitations are, and maybe even bust a few myths along the way. Like, for example, do you have to believe EMDR works in order for it to be effective? So let's jump in. What is EMDR exactly? The name kind of sounds like something out of a sci-fi movie, but it's actually a really structured form of psychotherapy designed to help people process traumatic or distressing memories. The goal is to reduce the emotional charge of those memories so they no longer hijack your thoughts, your mood, your sense of safety, etc. So EMDR was originally developed by Francine Shapiro back in the late 80s, and while it was once considered unconventional, it is now widely recognized as an evidence-based treatment for conditions such as PTSD. Now, here's the twist. Unlike traditional therapies where you're asked to talk through your pain, EMDR uses bilateral stimulation. So let's explain that a little bit. Bilateral stimulation is stimulation of both sides of the brain, often through eye movements, tapping, or alternating sounds from one side of the body to the other. So in EMDR, typically you are asked to follow a therapist's finger moving side to side as you recall a distressing memory, or you might feel gentle taps on alternating sides of your body. Some therapists even use headphones with tones that switch from one ear to the other. It sounds kind of strange at first, but there is a reason behind it. The theory is that this bilateral stimulation mimics what happens during REM sleep, when your eyes move back and forth rapidly while your brain is busy processing your day. EMDR essentially uses that natural mechanism to help reprocess memories in a more adaptive way. I like to say, instead of automatically processing your memories, this is a manual way to do it. In simpler terms, it helps your brain file the trauma away properly so that it is no longer running the show. So let's walk through the process a little. EMDR therapy is not just one technique. It's actually typically an 8-phase process. So if you're imagining that just sitting down and waving your eyes around, there's much more structure to it than that. It starts with a history taking and treatment planning, where the therapist gets a really good sense of your past experiences and what you want to work on specifically. And then there is a preparation phase. This is crucial. It involves building up your coping strategies and grounding tools, such as breathing exercises, so that when the hard stuff comes up, you're not overwhelmed. After that, you move into the assessment phase, where you identify a target memory, along with the negative beliefs and emotions that come with it. For example, you might remember a specific event with your family and notice that you had the belief, I'm not safe, or I'm not good enough. And then we hit the heart of EMDR, which is desensitization. This is where the bilateral stimulation comes in. You focus on that memory while following the movement, the tapping, the tones, whatever it might be. Over time, and usually it doesn't take as long as people expect, the memory becomes less distressing. Next comes installation, where you start to replace those old negative belief systems with healthier ones. So instead of thinking, I don't deserve love, you might begin to internalize, I am worthy of connection regardless. After that is the body scan, which checks for any lingering tension in the body. Trauma, as many of you know, often lives in the body as much as the mind. So then we wrap up with closure to ensure you feel stable, and finally, reevaluation in future sessions to track your progress. Now, you might be wondering, okay, but does this actually work? Let's look at the research. So over the years, EMDR has built a pretty solid track record, especially when it comes to trauma and PTSD. One study found that long-term PTSD symptoms were reduced that lasted 15 months after treatment. Another study, that study was from 1997. Another study performed in 2016 showed that it helped military personnel with combat-related PTSD. And yet another study in 1998 reported reductions in chronic PTSD symptoms even in small sample sizes. So yeah, it's not just hype. There's empirical evidence backing this treatment up. And it's not only used for trauma. It's been used to treat anxiety, phobias, even depression and addiction. Though here, the picture does get a little bit more nuanced. For example, one study performed in 1997 found EMDR helpful for panic disorders, but exposure therapy was equally effective. And in children with phobias, another study in 1998 found that exposure therapy actually worked better than EMDR. It's not saying that EMDR was not effective, but their exposure therapy had better results. Still, when it comes to trauma-related depression, EMDR shows a lot of promise. One study performed recently in 2024 looked at virtual reality-based EMDR and found that it improved major depressive disorder linked to childhood trauma. And another study in 2010 found it very helpful for women in addiction recovery, again, by targeting the underlying trauma. What's really interesting is that EMDR has been used outside of clinical diagnoses too. Executive coaches like Foster and Lindell in 2007 used it to help professionals bounce back from workplace setbacks. And it's even been used to reduce internalized shame and improve self-esteem, according to a study performed in 2000. So no, it is not a miracle cure by any means, but it is definitely more versatile than some people realize. All right, so let's tackle the big question now. Is this like a pseudo effect? Do you have to believe in EMDR for it to work? Is it just placebo? The short answer is no. While being open-minded can definitely enhance your experience, belief is not a prerequisite when it comes to EMDR therapy. Even skeptical clients often see results. Francine Shapiro, the founder of EMDR, emphasized that the process works on a neurological level. It's not just about faith. It is about your brain and how it is wired to process information. For instance, think of a combat veteran who is totally skeptical of therapy, doesn't believe in it, thinks it's all fluff, but during EMDR, they find that the painful memory they've been carrying for years doesn't hit as hard anymore. It doesn't cause the same rush of fear or guilt or panic. That change did not happen because they believed in EMDR. It happened because their brain was finally able to process the memory differently. It's kind of like how antibiotics don't require your belief to work, they just work. So to wrap up, EMDR is a very powerful tool. It doesn't work for everyone. It's not always the best fit for every type of mental health challenge, but for trauma, for distress that feels stuck in your system, it is one of the most promising treatments out there. It does not require you to talk through every painful detail. It doesn't require you to believe in it, but it does require courage, the courage to face what's hard and the willingness to try something new. If you or someone that you care about is struggling with trauma, PTSD, or just feels stuck in old emotional patterns, it might be worth exploring EMDR with a qualified therapist. Personally, I can say that I was very, very hesitant and skeptical of this type of therapy, and I went to the Mississippi State Counseling Services, and my counselor there was trained in EMDR. I've been working through this therapy for a while now, and it has been incredibly life-changing and helpful. I can definitely recommend it. So thank you for spending time with me. If you found this helpful, consider sharing this information with someone who might benefit. Take care of yourselves, and thank you again for listening.